Hello and good afternoon to everybody. Thank you so much for joining this talking point. Welcome. We are just letting people in at the moment. So we currently have 34 people coming through the doors. So just going to wait 30 seconds or so just to make sure everybody is in and has joined us that would like to. Great. I think we are holding at 45 participants, which is great. So welcome everybody to this next Centrepoint talking point. It's a real delight to see so many of you with us today. I'm Di Gornall. I'm the Director of Fundraising at Centrepoint. And without going any further, I would like to say a huge thank you to all of you for your amazing support of Centrepoint. We honestly could not deliver the services that we do, the vital services for young people, without the support from people like you. So it's a delight to have you online today and listening to Isabel, who's going to be talking to us about food insecurity today. In terms of the tech, we're going to be taking questions on this session. We'll be fielding questions at the end, so we're going to let Isabel do a clear run through, and then we will do a Q&A at the end. If you do have questions, please pop them into the Q&A chat at use the Q&A button, and by all means post your questions in there. We will answer as many as we possibly can live today, and hopefully we will have time. If we don't, I will make sure that we answer any additional questions after today's session. We expect to run for about half an hour, so up through till 1 o'clock. Great. So I think without any further ado, I'm going to say a really big welcome and thank you to Isabel. Isabel is our senior dietitian at Centrepoint, and she kindly today will be talking to us about food insecurity and give us an overview of food insecurity, but also talk to us a bit about what's happened in the COVID crisis. So Isabel, over to you. Thank you so much for joining us today. And I will stay on off mute until you've shared your screen. I'll confirm that your screen is okay, and then I'll put myself on mute as well.
Great, thanks very much, Di, and welcome everyone. As Di just said, my name's Isabel, and I'm the senior dietitian here at Centrepoint. So I manage a small team of dietitians. Right, can everyone see my screen?
Not yet. Yes, now it's coming.
Okay.
Is your present? Aha, here we go. Yeah.
Okay, let's get started then. Yeah, so as Di said, I'm going to talk to you a bit about food insecurity today. So there'll be a little bit of background. I'm talking about how that manifests at Centrepoint, and then talking about some of the projects that we are running here at Centrepoint as well. So firstly, what is food insecurity? It might be a term you've heard before. You might have also heard food poverty being spoken about. So the two terms can be used interchangeably, but I think food insecurity is a bit of a broader term. So if you see this scale here, we can think about mild food insecurity at one end, where you might be worrying about being able to afford food, maybe having to have a very strict budget. Moderate food insecurity, whereby you're having to compromise your nutrition.
Isabel, sorry to interrupt. The sound is slightly intermittent. Did anything change between our practice run and now in terms of your volume or sound?
Let me just try. It might be the connection, so I can pair it with my phone.
Somebody has actually suggested that you could turn your video off if needed, which isn't a bad idea.
is that any better in terms of the sound quality?
It's not great, to be honest. That's so strange. Sorry, everybody. We tested this just now and everything was fine.
Yeah. Okay, well, I've tried connecting to my mobile hotspot instead of the Wi-Fi. Is that working any better?
No, that's actually worse, I would say. In fact, definitely worse, yeah.
Isabel, are you able to move closer to your router at all and see if that helps?
Let me try that.
Oh, that was the clearest we've heard you just then.
Yeah, something's just said your speaker.
Isabel, are you still there?
Can you hear me any better now?
Oh, much better.
Okay.
Great, thank you. Sorry, everybody. We will be back on track in just a moment.
Sorry about that. I wonder whether it's the screen sharing, but let's try again.
Okay, that's shared well. And now say something.
How can you hear me now?
Perfect. Okay, let's begin again. Thank you all. Sorry for the delay.
Hope it holds up. Yeah, this was where we were. Okay, sorry everyone. Please just let me know if the sound is still not good. But I'll just start again from where I was here. So we were talking about the definition of food insecurity, which is quite broad and encompasses mild on the one end, where you might be worrying about food and having to budget, moderate, where you're compromising the actual quality of the food that's coming in, or having to reduce how much you're having, and then hunger on the more severe end, where people would experience hunger and maybe be reliant on food banks and food donations. So thinking about the scale of food insecurity in the UK.
Isabel, sorry to interrupt again. Your slides are not moving. Or, yeah, your slides are not moving. We're still on the first slide.
Right. Oh dear, let's try again. How about now?
So we're on the first slide.
No. With mine on my screen, it is moving.
Okay. Somebody suggested try unsharing and then resharing. So let's just try that.
Try that. Let's try sharing again.
Ah, here we are. Lovely. It looks right now. Let's try again.
Okay, let's fingers crossed that will be okay this time. So what I was saying was about the scale of food insecurity in the UK. It's something that we don't really know because it hasn't been measured on a national level. So we don't really have accurate statistics. But interestingly, last year is the first year that the Department of Work and Pensions have actually trialled measuring this on a national level. So next year, we should be due to see those published results. So it will be really interesting to see. If we look at Scottish health survey, we know that about 19% of adults are food insecure, and a similar survey just in England found about 20% of people are food insecure. So perhaps a higher number than you might have thought. And the Trussell Trust, which is the biggest food bank network in the UK, last year they gave out 1.6 million 3-day emergency parcels to people in need, and that was a 19% increase from their previous year. So if you can see the graph at the bottom of the slide there, you can see how year on year food banks are having to give out more and more food parcels. If we think about child poverty, it was estimated about 4.2 million children were living in poverty 2018 to 19, which is 30% of children, or 9 in a classroom of 30. So that's, to me, that was quite a shocking statistic. And actually London has the highest rates in the country, so it's probably even higher than that in London. I should point out these are all pre-COVID statistics, so it's probably higher now. And living in child poverty, this can affect children's school attendance, their performance at school, their behaviour, and also, of course, their health. And the way this manifests itself, when we look at GCSE pass rates, there's actually a 28% gap between children receiving free school meals compared to their wealthier peers. So it can have a big impact on their performance at school. So what about our young people at Centrepoint? So they're more nutritionally vulnerable than your average 16 to 25-year-old. This is because they've probably come from a context of child poverty. So they would have grown up without all of the nutrient stores that they need. This affects your health, your immune system. And they might also not have those food skills around cooking, shopping, budgeting that other young people might have. So this puts them in a worse position. And they're also at really high risk of food insecurity. So this is because low income, precarious jobs, disadvantaged background, maybe not having family support, and then things like homelessness, substance use, health problems. This all increases your risk as well of being food insecure. And once you leave school, at school you may have had access to free school meals, snacks, and other support. Once you leave, that support all goes as well. So we know as well that 16 to 24-year-olds are among those that are most likely to be skipping meals or using food charities. So that's really the age range that we work with. And it's also important to think that food might not be your priority if you've got other serious issues around homelessness or difficulties in relationships and things like that. Food might not be what you prioritize spending your time and money on. So let's look at some research that the Dietetics team have done. Last year, we did a questionnaire in Lambeth asking around experiences of food insecurity, and we found that 45% of young people had said they'd gone hungry in the last 6 months. 68% had run out of money and been unable to then buy more food. And we did a similar questionnaire across England, so London and the North, and we found that 62% reported being severely food insecure. So if you think of that scale, that's at the end of being hungry, having to go to food banks, that kind of thing. And 27% had experienced food insecurity every month out of the last 6. So it wasn't a one-off occurrence, it was actually something that's chronic. There's some quotes here from young people that I've actually heard young people say to me in terms of their struggles with food insecurity. So we might see things like losing weight, not being able to buy healthy food, only eating once a day, or actually having to ration your food out so that it doesn't run out even though you're hungry. And thinking about COVID-19, regarding food insecurity, this has been described as a crisis on a crisis. So if you think about the figures I talked about that there already were before the pandemic, food insecurity is now much higher than it was. And at Centrepoint, so the emergency food requests, this is something that the dietetics team support with when someone's in hardship. These have actually doubled compared to the previous few months before lockdown. And actually December and January is a really high period of need anyway. So even with that, it's doubled. So it's really high. How does this impact health? So food insecurity obviously impacts people's health physiologically. So if you think of the food that you eat is broken down into nutrients, and we use those for our brain to work, for our organs to work, for our body to work in the way that it should. So if you don't have a good diet, your body won't be able to work optimally, your mental health can't be optimal, but also psychologically. So worrying about where your next meal is coming from and feeling anxious, that also is really detrimental to your mental health. And this cycle I've put here is just to demonstrate that people who have chronic disease are much more likely to experience food insecurity. But when you're food insecure, you're also much more likely to develop chronic disease. So it's this kind of vicious cycle that we see. And this is where we talk about the health gap. So people from disadvantaged backgrounds, they have a shorter life expectancy, but whilst they're alive, they also have worse health. And how does it affect education and employment? So I thought I would just tell you a little story about a young person from Centrepoint who was working with the learning team here to try and get his English qualifications. He was British, he'd been born and bred in Britain, but his reading and writing level was so low, they initially thought he was actually illiterate. After spending a bit of time with him, talking to him, they found out that he hadn't been eating properly for months, and it had actually been a few days since he had anything to eat. So
Oh, Isabel, we've lost you again, the sound.
How about now? Is it still?
That's very crackly again.
Oh, I'm not sure what I can do.
Okay. Keep going and we'll just keep tracking it.
Yeah. Okay. Let me know. I can always unshare and share again. Okay, well, keep talking and tell me if you can't hear.
Yeah, it's just slightly crackly now, but let's keep going. Yeah.
Yeah. So where was I? I was just saying, so about this young person, once we realised that he was so food insecure and were able to provide him some support and increase his access to food, his performance actually went up dramatically, and he was then able to do his GCSE English. So it turned out that a lot of the difficulties were coming from him not actually being able to concentrate and work properly because he was so hungry. So let's think about some of the projects that we're doing at Centrepoint with the Dietetics team. So we're kind of on a mission to try and end hunger among our young people. So this is our Zero Tolerance to Hunger campaign. One of the projects that we're working on are the emergency food cupboards. So the way this works is we'll install a cupboard in services. It will be filled with long life food supplies so that if anyone is going through hardship and in need of food, they can immediately access that to try and mitigate them going hungry and having that period of anxiety and hunger. So we try to use foods that people are familiar with, that are balanced from the different food groups, so they're able to create healthy meals. We provide some recipes and some guidance alongside that. And also, really importantly, it's an engagement point, so they can talk to staff, they can talk to their key worker about what's happening, the difficulties that they're having, and they can also have support from a dietitian if they want to help them with budgeting and healthy eating and the food insecurity that they're going through. Another project is called the Food Point. This is our social supermarket in Lambeth. This opened end of 2018 and we've helped more than 150 young people so far. This is a picture of me on the launch day. So how it works, it's like a little food shop that has some other essentials as well. It's open once a week and young people are able to access fresh, frozen, long life range of foods, good quality foods for a very, very low price, or if they're in hardship, they can use it for free. So to make this work, we partnered with Fair Share and City Harvest, which are charities that redistribute surplus food from the food industry that is good but was going to be wasted. And we also have donations from other companies of food, other organisations, and we buy in some food ourselves to make sure that we have a really good range of food. So this picture just shows you the Eat Well guide. This is the UK healthy eating guidance, and it shows you the different food groups. So the way that we've set the social supermarket up is that young people can choose whatever items they want from within the different food groups. So everyone takes away a balanced shop and gets to have some of everything, and they have their own choice of what they want to take from that. These are some examples of people's shops that we've just taken at the till. And we think of it as being more than just a shop. So there are some quotes there that young people have said. I'll let you have a look at, but also to mention that it's not just a shop. Alongside it, we also have a social event that runs where we cook and share a meal together. There'll be health drop-ins from other health professionals, lots of different activities people can take part in. For example, recently we had one about BAME mental health. And we've also both heard from young people and observed reduced anxiety around shopping, around food, and around just socializing and being with other people. So recently, during the pandemic, the dietetics team have really worked hard to support services all the way across London. So to do that, we've set up some more food hubs in different boroughs, whereby food is coming in and then getting distributed out to people that need it. More of the emergency food cupboards. We've started a weekly wellbeing newsletter for young people, as we're not able to do group activities at the moment. So we're distributing this newsletter which has health information, and so young people know how to contact the health team if they want to. New partnerships for food. One of them is the Ned. So this picture you can see here, the Ned is a hotel, and their chefs have been making fresh meals every day, which are then packaged up. Volunteer drivers come and pick those meals up and deliver them to services for young people to eat. We also have supermarket shopping vouchers, which can be given to young people who are in hardship. They can then go and buy their own food that they need in a dignified manner. Supporting and training for housing staff to raise awareness. And the dietetics team also offer one-to-one more clinical support for people that need that support with their diet and health. So we're continuing to do that virtually. Looking forward, what we're hoping to do in the future. So we've written a food policy that we're looking to launch, and that goes alongside our Zero Tolerance on Hunger campaign, and that's kind of looking across the whole organisation, how we can improve the food environment here. We want to open up more food hubs and cupboards to make sure all young people can access food when they need it, train staff, keep doing the research, looking into food insecurity, diets of young people, and what the effects of COVID-19 have been, working with our partner organisations, and working with fundraising to continue our projects. So we're really hoping to get funding so we can keep doing these projects and further projects in the future. And we work with our brilliant policy team as well. So using all the data we have, we can put that together into research and then try to lobby the government to improve things for young people, as well as other public health interventions around generally improving people's health and diet. So that's it from me. Sorry about the technical difficulties, but thanks for listening. And if there's any questions.
Isabel, that was absolutely great. Thank you so much. If you would, and the sound improved again, so all good. If you can stop sharing your screen, we'll come back on screen. And we already do have a couple of questions lined up for us. So the first one came in before the session today around the cost of eating healthily. And the question was, does it cost more to eat healthily? And why is that? Is it to do with the price of food, lack of education, for example, in preparing healthy food? Or is it easier just to eat unhealthily?
So it's not a really simple question to answer, but I'll have a go. So I think thinking about food price, something I would say there is you can't produce good quality food in a sustainable way that's really cheap. That doesn't really work. So I think that trying to make food really cheap isn't really the answer, is the first thing I would say. I think the bottom line is we need to try and increase people's incomes and make sure people are having enough income to survive off. But in terms of eating healthily, I think if we do look at the cost of food and we look at what people spend on food, in general in the UK, the average household only spends something like 10% of your total income on food, which is a really low amount actually. But when you look at people who are on the lowest incomes, it's a much higher proportion of their income, but a much lower actually amount of money. So if you think about what you would be able to get for that, the kind of foods that we're told to eat that are more healthy for us, things like fresh fruits and vegetables, fresh fish, those foods are expensive. And if we look at people's diets, we know that people in lower income groups have less things like fiber, vitamins and minerals that we do need to be healthy. And I think a lot of that is because it is expensive. If you need to be able to fill yourself and fill your family, you will choose foods which are cheaper and more filling. Can you eat healthily on a budget? I think you can. Certainly you can. There's lots of resources out there. There's a famous blogger called Jack Monroe who writes a food blog, and each recipe is about 30p each. But I think that's heavily reliant on you having food skills. So being able to cook, knowing where to shop, knowing how to cook from scratch, having the time, having the mental energy to do that. So I think to say that that's definitely not easy. You need skills, and then you need all of that energy on top of that. So I think that it's possible, but it's really hard to do. So it's definitely easier. If you're a young person who has a few quid and you're not very confident with cooking, you're going to go and get chicken and chips because it's going to fill you up and it's going to taste nice. If you try and cook something and it doesn't work out right, then you've lost your money, the food's ruined. So you can't afford to experiment with food.
Yeah, great, thank you. Our next question is around why food insecurity has gone up during lockdown. Is it because young people's networks have shrunk? So talk us about why you think food insecurity has increased during the COVID crisis.
Yeah, so I mean, this is fairly speculative because I don't have all the data on this at the moment, but I would say partly it's to do with precarious income and people maybe losing their jobs. They've had 0 hours contracts that will have now gone down. Partly because a lot of support has gone. So where young people may have used social events or may have used other events at Centrepoint or with other organisations where they could have got free meals. So I've actually spoken recently to a young man. He's on universal credit. He's getting the same amount of money, but where he used to get meals and food support from other places, he's now not. So he's having to completely fund all of his food, which means he's having to spend more on food. He's not able to get things as good quality. He's having to, reduce the amount that he's having because there's no other support there for him. So I think some people will have had their incomes go down. Some people will have had their food costs go up and less support. And I think also there was a lot of worry in lockdown around food supply and supermarkets not having everything that's needed. So they may have had to then go to a more expensive shop to find the things they needed, shop around more. So it wasn't as easy to access food as well.
Yeah, great, thank you. I'm conscious of time. I think because we started late, we will run over. So I will aim to close this session at 1:10 just to give our guests some idea of timeline. So Isabel, the next question is, do any of these projects happen outside of London? So
we only have a dietetics team in London at the moment. We don't have any dietitians in the north. We do communicate with the north, so as you will have seen, some of the research was done also in the north, so we can have an idea of what's going on there. And we do offer some level, for example, the supermarket shopping vouchers for people in hardship, and we've had some communications around food cupboards, but at the moment we don't have capacity to be offering a full service up in the north because there aren't any dietitians there.
Great, thank you. In an ideal world, what initiatives could the government put in place to help tackle food insecurity, especially post-COVID?
Oh, that's a big question, and I think generally the consensus is that people's incomes need to be higher. So people who are living off of benefits, where there's been a lot of changes, there's now gaps in people receiving money, there's benefit caps, people are not really getting enough money, and where there's things like 0 hours contracts, there's not a lot of protection in there for people. So I think I think really it's about thinking about what a real living wage is. But also there's a lot of questions about our kind of agricultural system and the way that we produce things here, and whether things could be done differently, whether things could be done more locally. That's not really my area of expertise, but I know there's a lot of work being done at the moment on how can we improve this, and a lot of organisations are looking at it at the moment. Yeah, largely, yeah, improving people's incomes, but we might need to re-examine the way that we produce food as well.
Thank you. COVID-19 affects the BAME community more than others. Are there specific programmes in place to make sure that they have access to these services?
Yeah, so within Centrepoint as a whole, we do have a BAME working group, and then within the health team as well, we also have one which specifically is run by the mental health team. So it's looking at targeting people from BAME backgrounds and mental health issues because of the stigma there, but we all work as a multidisciplinary team, so we do all work together on that. So for example, they've done some events at Food Point, including food. So in terms of the COVID provisions, well, young people at Centrepoint, they are much higher levels of BAME young people than in the general population. So what we've really tried to do is make our food programs inclusive, make sure all services are able to access them, try and include things like culturally appropriate foods as well, because otherwise people just won't want to eat it. So we try and consider those things and try and listen and actually ask young people what it is they want. So that's always really important to us, actually producing something young people want. So did that answer the question?
Yeah, it did. Yeah, it did. Lovely. Thank you, Isabel. So where are Centrepoint's food hubs now, and are they going to be just in London? I think I might take that one, Isabel. So we set up the food hub in Lambeth as a trial almost 2 years ago now, to ensure that we got the learnings that we needed in order to then consider how we expand those services. The Camberwell, it's based in Camberwell, in one of our larger services for young people. And obviously over that trial period, we've learnt huge amounts about the very best way to deliver a food hub to young people. And our ambition would be that obviously that would be available more widely, not just in London, but across Centrepoint services across England. Isabel, was there anything else that you would like to add to that answer?
No, yeah, I think that's correct. I mean, at the moment, we've got our food hubs are in Hammersmith and Fulham, Haringey and Lambeth, and they've all been really successful and had good feedback. So based on that and based on our capacity, really, we will try and expand that. That's something that we're really hoping to do.
Great, thank you. And our last question for today, there is some chat which I just need to go into before we close off, but the last question in the Q&A was, do we offer cooking workshops for young people? With an apology that if they missed it, they're sorry because during the sound problems, but do we offer any cooking workshops to young people?
Yes, we do. Obviously not at the moment because of health and safety kind of regulations, but that will be something we will bring back in when we can. So it's part of Food Point, actually. Young people, we have a volunteer chef who comes in and makes a meal with whatever ingredients we have, and young people can come and help with that. So usually we'll have a couple of young people who will come and help us prepare the meal. There is also a chef that does work for Centrepoint, and he does lots of cooking classes and cooking qualifications as well. So there are lots of opportunities to get involved with cooking workshops and things like that here. And as dietitians, we do some cooking in our one-to-one sessions. That's more kind of related to people's health and adapting things as needed, but that's something we're really lucky to be able to offer that.
Yeah, absolutely. Thank you. And then there is just one question in the chat. Where are the food cupboards is the question.
Where are the food cupboards? There's quite a few now. So I think in 2019 we did our sort of pilot where we made 10 and it was all working really well. So we've now most boroughs in London will have at least one, and it's dependent on how many services there are in the borough, but our aim is that all young people should be able to access one. So they should either have one in their service or have one in a nearby service that they could go to. So we're not there at the moment with every service having one, but most boroughs in London now have one or more.
Great, lovely, thank you. Well, you've definitely sparked some chat as well, Isabel, with your presentation around the challenge of food insecurity. So, we'll leave it there for today. Isabel, huge thanks for your time and today and sharing everything that you know about food insecurity. What an interesting way to spend half an hour. A massive thanks, of course, to all of you that logged in today to hear from Isabel, and thank you so much for your ongoing support of Centrepoint. It really is hugely appreciated. I hope you enjoyed today's session, and we are running regular sessions, regular talking points, so please do tune in again next time. We look forward to seeing you then. Thank you, everybody, and have a good rest of day.